Hello again, everybody. This is Craig Evans of Autism Hangout, and thank you for tuning into this installment of the Autism Hangout feature program series, Ask Dr. Tony, where everybody's favorite expert on autism and Aspergers, Dr. Tony Atwood, addresses your questions. Welcome, Dr. Tony. Good morning over there in Australia.
Good morning or good evening to you, Craig, in the USA.
Takes a while for me to get used to this 15-hour difference, but I'm just thankful for Skype that we can address the questions from people in Autism Hangout and YouTube.
Excellent. I think it's a brilliant idea, and I've been presented with 19 questions, so let's get going.
We have a link, so let's get to it. Okay, the first 9 questions are from people on the spectrum. Dr. Tony, my question is, how can I tell if other people are treating me badly or if I'm just overreacting to their behavior? And this is from J1 at Autism Hangout, and he's describing a workplace situation where his boss appeared to be venting, but he's not sure.
Okay, I think there are 3 factors here. One is a tendency to sort of personalize events. In other words, somebody could be having a bad mood, but thinking, what have I done to cause their bad mood, without realizing their car wouldn't start, they couldn't pay their mortgage, etc. There's a tendency to think it's something to do with me. The second one is that people with Asperger's can be very sensitive to emotional atmosphere. And if somebody is in a bad mood, there's almost an overreaction to negativity in other people. And so I think in this situation, if he thinks that his boss is treating him badly or other people are doing that, he needs more information and really to start working on some phrases of, I'm confused, are you annoyed with me? Or I'm sensitive to what you say, I pick up annoyance, is it something I have done? So really, yes, it is a genuine problem, but you need more information from the person. So work out what I call a spoken social story developed by Carol Gray that gets you more information as to how that person is feeling and then what to do. Just ask them.
The next question is, hi, I'm recently diagnosed and I'm studying to become a psychologist in Northern Europe. In an earlier episode, you had mentioned that you knew several therapists with ASD. I have heard from my teachers that the best is the person's empathy. I find this depressing since Aspies, by definition, have problems with empathy. What do you think about this? I also wonder if you have some general advice for an Aspie regarding the challenges of becoming a therapist or psychologist. And this is from Aspies at Autism Hangout.
Well, first of all, good on you for doing psychology, and I think you should, and you may well become an excellent psychologist. What I'm hoping to get is psychotherapy designed by Aspies for Aspies, because they really do understand. Trouble is, neurotypicals don't understand Aspies. Now, I'm going to go through several points on this, and this is one of my soapboxes, opportunities of empathy. And to say that those with Asperger's don't have empathy is a gross insult. What it is a difficulty reading the subtle cues in facial expression in particular, when affection, compassion would be expected, that leads neurotypicals to then accuse the person of lacking empathy. And yet people with Asperger's can be some of the kindest people and extraordinarily sensitive once they've read the signals. So it's not a lack of empathy, it's a difficulty reading the signals. Now, research has shown there is 3 types of empathy. Now, there's cognitive empathy, which is knowing, and that's the person with Asperger's major difficulty. There's emotional empathy, which is feeling. Often they can feel, and sometimes they are oversensitive to that. And partly the social withdrawal is that they're overly sensitive to negative atmosphere. It's painful. And compassionate in how to respond. Now, for that with Asperger's, often the way of feeling better is solitude, special interest, a whole range of things that you've got to think neurotypical. But people with Asperger's have been observers of humans since they were little children. And so they became a psychologist at the age of 3. And so if you're 23 years old, you've got 20 years of psychology. Now, there's an excellent book here. I hope to pass it on. It's called Raising Martians from Crash Landing to Leaving Home by Joshua Muggleton, published by jkp.com. And Joshua has Asperger syndrome and he's training to be a psychologist. I've written the foreword to the book, and he has a remarkable insight into Asperger syndrome. So I would encourage you to become a psychologist, and I would also suggest that you abandon all the previous psychological theories because they were designed for neurotypicals. And that you start developing your own psychology or theory for Aspies. So I think from my point of view, a very well-valued colleague of mine, Rachel, she has Asperger syndrome and she's a psychotherapist. So I think the problem is not you, it's your teachers having the textbook understanding of Asperger's, not the real clinical experience.
Wow, so he can literally bring them into the current age just by talking to them as to who he is. That's wonderful.
Yes, and to say that there's a problem with empathy, yes, there is. But often the person with Asperger's may pick up empathy by other channels, not the conventional. See, when we do the testing, reading in the eyes, etc., that channel is a difficult one, but there are more channels than that to work out emotional atmosphere. And I think some with Asperger's almost have a sixth sense of picking up things and can be oversensitive, but they can't tell you how they pick that up.
Mm-hmm. Very good. Hello, I have autism. I don't really get the differences and connections between autism and personality disorders. Are they something completely different, or are there connections? And if these connections exist, what are they, and to which personality disorders? This is from Auti on YouTube.
Okay, very interesting question. Two dimensions to this. One is history. People with Asperger's are not psychotic, are not intellectually disabled, but clinicians will have met them for various reasons and use their training to describe the characteristics, like schizoid personality disorder or non-verbal learning disorder, etc. And so historically, such individuals have been fitted into a personality category, and those historically can be used. But the other point is, how do you cope with having Asperger's syndrome? Some can become quite arrogant, and it's a compensation mechanism for not fitting in. You soothe yourself and support yourself by saying, I'm better than other people. So you then are accused of having narcissistic personality disorder. There can be other things too, in that with your fear of rejection, intense emotions, and intense despair, as a woman, well, sometimes as a man, you can be then viewed as having borderline personality disorder. So it's how you've reacted to the situation. So I think in many ways it's historical and it's how you've adapted. And sometimes the adaptations to Asperger's, if they're not positive and constructive, can lead to the development of a personality disorder.
The next question has two parts. While I'm focusing on other stuff, I forget to swallow, and I get quite a buildup, to the point that someone has to remind me to swallow. And more rarely, the opposite happens. I suddenly notice that my mouth is quite dry, as if I'd forgotten somehow to produce saliva. That's the first question. The second is, some people continue thumb-sucking into late stage, quitting late or never quitting. Is any of these two distinct behaviors common with Aspies? This is from Aspie PT at Autism Hangout.
Okay, I'll take the first one there, and people with Asperger's tend to have what I call a one-track mind. They are hyper-focused, but it's at the cost of other broader abilities, and that can include toilet training. For some, you realise, especially when they're kids, at the last moment, oops, I've had an accident, because I was so involved. Sometimes you need almost like an alarm clock to go off every so often to indicate I need to either go to the toilet, to swallow, all those sorts of things. So it is that hyper-focus, great for work, but a problem if you need to multitask. Now, the thumb-sucking, etc., is with Asperger's you have high levels of anxiety, and you will do things that are soothing. It's a natural human characteristic. Now, that may be thumb-sucking, it may be twiddling your hair, it can be fiddling with something, rosary beads or something like that. A relaxing, soothing, repetitive behavior. Thumb-sucking is viewed as associated with children. It's finding an acceptable substitute. Some people smoke cigarettes. I'm not suggesting that one, but they like the oral sensation. Mm-hmm. Some will put a pencil in their mouth, etc. So there is something in humans about putting something in your mouth that is soothing and relaxing. And if you've got a pencil and you pop that in your mouth, I would have one here, nope, nope, then that is something that allows you to soothe. So find something else.
That's a good solution. This next question also has two parts. I don't know what to do. I have Asperger's very light. I think tough. And I'm scared that when I get older and I get a wife, how will I tell her I have it? And will my kid have it? This is from PvP Monstar at YouTube.
Okay, this person has Asperger's very light, so it's obviously not that conspicuous. So somebody meeting you may not very quickly pick up the differences. Now, when you do meet a wife, how will I tell her? Well, what it means is that she is likely to fall in love with many of the positive aspects of Asperger's syndrome. And she will initially find those highly endearing, and one of the reasons she falls in love with you. But then there may be other aspects that are missing or confusing, and she will start after a period of time, which may be months or certainly possibly years, to realize there are certain qualitative differences. My view is to try and explain that fairly early on, but to explain the positive components, that it makes me a very loyal person. I will be very dedicated to the relationship. I'm not going to be heading off to see other women, anything like that. But sometimes I may have difficulty knowing how to respond to your emotions. And sometimes I seem to be so focused on what I'm doing, I've missed that I need to be doing things for you. The next part is, will your kids have it? And in that, there is no test we have at the moment. And in half the cases that I see, there is a family history of Asperger-like features. So what I would ask the couple to do is do a family tree of both families. And for each person in that family tree, a score of 0 to 100 as how Aspie they may be. And so you can then see what geneticists call penetration. That is, how many people throughout the various generations have those characteristics, to look at the statistical risk of recurrence. But with any child, we wouldn't know if they're not on the spectrum until they're at least 3 to 4 years old. So whether you would have a subsequent child with those characteristics, it may be a possibility. But there's a lovely quote from Stephen Shaw when asked about he and his wife having children. And he said, oh no, we don't want children. I mean, they could be neurotypical.
Somehow I knew when you said Stephen Shore there was something like that coming. That's beautiful.